Hi, I'm Dr. Miner. Today we are going to do an experiment and demonstrate the effectiveness of the laser on cleaning off a tooth that was affected with periodontal disease. And what we have here is a tooth that on one side of it there was some very aggressive periodontal disease and basically eroded all the bone off. And so when we extracted that, we ran it through our sterilizer to sterilize it, and then we got it in some water just to keep it hydrated as though it were in the mouth. And so now we're going to take a scaler and clean a little bit of this off. And as you can see in the pictures, you can hardly see any of the deposits. But once we get to the laser, you're going to see the tooth go nice and clean. Alright, so this side of the tooth is the one that had the periodontal disease, and this side was in the bone. And so sometimes we're going to scrape this. Some of this dark stuff is deposit, but when you feel it, like as dentists and hygienists, what we're trained to do is feel the tooth for how smooth it is. But you can see there's still deposit that's on here. Okay, so I'm going to scrape a little bit of this. Sometimes as we scrape it, there we go, we can kind of see those deposits coming off, but that helps with running through the sterilizer. It comes off easier after that. Okay, so I'm going to scrape this just a little more, get some of this stuff off, which again, this comes off easier after it's been through the sterilizer. But normally in the mouth, this is really hard to get off, especially when it's so smooth. But here we can see some of the deposits that were on that tooth.